Think of your colon or your large intestine like a 6-foot-long highway located at the end of your digestive tract. This pathway out of your body is responsible for processing waste so that it's easier and convenient to have a bowel movement. When you have ulcerative colitis, inflammation causes open sores or ulcers to appear in the superficial lining of your colon. Like potholes in the middle of a road, these ulcers cause a variety of complications that result in a painful path forward whenever flare-ups occur. As one of the most common types of inflammatory bowel disease, ulcerative colitis affects nearly 1 million Americans. Although there's no cure for the condition, people will often have flare-ups followed by periods of remission where they don't experience any symptoms. But if flare-ups persist over long periods of time and are left unmanaged, symptoms like diarrhea, bleeding, severe cramping, and increased bowel movements can worsen. Over time, these can lead to an increased risk for anemia, colon cancer, osteoporosis, severe bleeding and damage to your colon, dehydration, blood clots, inflammation in your liver and other parts of your body, a colectomy, or a removal of all or part of your colon. Doctors don't know what causes ulcerative colitis, but it's believed to be directly tied to an overactive immune system. Your immune system's job is to fight off toxins and other foreign invaders, like bacterial and viral infections. But when your immune system becomes overactive and turns against itself, it can cause chronic inflammation to spread throughout your large intestine. That inflammatory response then causes damage to the cells lining the inside of your colon, leaving ulcers in its path. As a result, your large intestine can't absorb water the way it should during its final stage of processing. And that's why you end up with the frequent diarrhea and blood-filled stools associated with ulcerative colitis. Doctors believe there may be other factors too that increase your risk for ulcerative colitis, like your age, race, genetics. For example, most people diagnosed with ulcerative colitis are diagnosed with the condition before their 30s. And you're at higher risk for the condition if you're white or of Ashkenazi Jewish descent. The path to recovery for ulcerative colitis varies, depending on where inflammation strikes hardest, how long it's been happening, and how much damage has been done to your colon. And while it's not entirely curable, ulcerative colitis is a condition that can be managed with treatment.